This is Clergy TV.
Hello viewers, my name is Morugi Muturi and welcome to Ask Your Doctor on Clergy TV. So, do you know how you can achieve a long life, a long healthy life for you and your family? Clergy TV now brings you Dr. Geoffrey Magada, who is going to help you answer your questions on how to live long and healthy for you and your family. This is Ask Your Doctor on Clergy TV, the home of empowerment. Karibu.
Clergy TV. Kenya is watching.
So, Dr. Geoffrey Magada, welcome to the show.
Thank you. Thank you for having me.
You're welcome. So today we will be talking about cancer because there are so many cases on the rise of cancer in Kenya and worldwide. So what is cancer? You kindly please tell us, what is cancer?
Thank you for that question. Cancer is an abnormal proliferation of cells, or we can say growth of abnormal cells. Normally, cells in the body do have a lifespan. They live for a certain period of time and they die and they're eliminated from the body. That is the normal situation. However, for cancer cells, they don't die. They continue to grow, to proliferate. And the worst part is that they spread to involve other areas of the body. And that's why it's important that we understand what it is and what we can do about it.
That's amazing. So cancer is basically cells that grow more than they are supposed to grow and for a longer duration of time than they are supposed to grow.
Right.
So how can we diagnose this growth, this abnormal growth of cells?
Usually, in most cases, early cancer does not have any symptoms. But as it advances, then symptoms develop. And therefore, we have to find a way, and we have devised a way of looking for it so that we find it early enough. And if we find it early enough, we are likely to have some interventions that will interrupt its spread and in some instances actually achieve a cure. But if cancer is found late, it becomes very difficult to intervene, and in most cases we only do what we call supportive care or palliative care.
Okay. So what you are saying, doctor, is when detected early, it can be treated.
Yes.
So can you kindly tell us what are the stages? Because there must be a stage for, you can say now this is an early stage, this is late for it to be treated. Can you explain to us the stages that are there of cancer?
Right. Actually, thank you very much. Actually, staging is a tool that we have to be able to know what kind of interventions we can give in every situation of cancer. And the common staging we use is the TNM staging. TNM is a technical term standing for tumor, nodes, and metastases. Mm-hmm. But in a simple language, the staging is based on how far the cancer has spread. Mm-hmm. If the cancer is limited to the tissue of origin, then it is in stage 1. Okay. But the moment it starts advancing to other tissues around, mm-hmm. and tissues far off from the tissue of origin, mm-hmm. then it is graded stage 2, stage 3, and stage 4. Mm-hmm. Stage 4 is now the advanced cancer, where it has spread to a wide variety of tissues, okay. in the body.
Okay. That is interesting. So, Daktari, what you're saying is you can start with cancer of the throat and then later on find out that the cells have shifted to the stomach or the colon. That is actually possible.
Yes, it is possible. If the cancer has started in the throat, it can spread to involve the liver, it can spread to involve the bones, it can spread everywhere. However, we need to know that the same cancer cells of the tissue of origin, for example, if the tissue of origin for the cancer was the throat, those same cancer cells are the ones that will be found in the other tissues where it spreads. If it goes to the bones, it will still be the throat cancer cells, but now in the bone.
Okay.
If it is in the liver, it will still be the throat cancer cells, but now in the liver.
Okay.
If it is in the lungs, it will still be the throat cancer cells in the lungs.
Okay, that is very interesting. And so since we are having such an increase of cancer in Kenya, it's as if there is a realization of this disease and at least someone knows someone who has died of cancer or has cancer. What would you say is the major cause of the prevalence of cancer in Kenya and globally?
We don't have a very elaborate answer to as to why there is an increase, but we do think that it is related to the lifestyles. We are taking a lot more calories, a lot more refined sugars, and a lot more animal fats. And we are exercising less.
Yeah.
These are things that could be putting us at risk to developing cancers. And also, we could attribute to the rise in the number of cases of cancer to the fact that we are less ignorant now. We are more awake to the fact that there is cancer, and so we are looking for it more. And we, of course, the fact that we are looking for it more, then we are getting more cases.
Okay.
Right.
That is very interesting. There sometimes you'll hear myths and misconceptions, or you will hear people say that cancer is caused by eating a lot of red meat or sugars. So none of those things have been actually scientifically proven that they cause cancer. Okay,
let me put it this way. They have not been proved as a cause, but they have been shown as an association that people who are obese, people who take animal fats, people who take a lot of refined sugars are at a higher risk of developing cancers. We also need to remember that these risk factors do not act independently. They have to be associated with other risk factors. And one of the other risk factors that we need to know that is significant is smoking. And another risk factor that is significant is a family history. So if you have a family history of somebody who has died from cancer, then you are at risk. Now, if you have a family history, and then you are smoking, and then you are eating animal fats and refined sugars, then you are at higher risk. So one risk factor does not just occur in isolation. It has to be in combination. And in fact, it is for that reason that we emphasize that we must be aggressive in risk profiling ourselves based on what we know about cancer. And this program is about alerting us on things that would put us at risk for cancer, so that we can risk profile ourselves and try and put in intervention mechanisms to prevent cancer.
Thank you so much, Dr. Magada. We'll take a short break, and when we come back, we are going to look at more questions regarding cancer.
Thank you.
Thank you so much, our viewers. This is Ask Your Doctor on Clergy TV. Please remember to subscribe, like, and share on our social media pages. And when we come back, we are going to look at more questions. This is Clergy TV, the home of empowerment.